I'm an occupational therapist. I am certified in sensory integration, DIR floor time, infant massage, and I'm a hippotherapy clinical specialist. Right now, I work in a pediatric clinic and also serve as adjunct faculty for an occupational therapy assistant program for their pediatric and mental health semesters. So I am going to share a little bit about my career as an occupational therapist and what you might be able to expect. One of the things about a career in occupational therapy is you have a lot of variety in practice settings, and I have focused primarily in pediatrics, and some of those settings for me have been early intervention, outpatient clinical settings, and then settings that incorporate hippotherapy or the movement of the horse into my practice. So the first thing I'll talk about is the early intervention setting. And when you work in early intervention, you are working with children that are birth to 3 years old and their families. So you are going into their home typically, but you could also be working in a daycare setting and working with them in a community-based setting where you're going out to a playground or meeting the family at the grocery store if that's where the challenge is happening. So a day sort of in the life of an early intervention occupational therapist would be setting your own schedule, which is really super nice, but it also means scheduling those visits and driving from house to house. So you're going to the house, meeting with the family, and following the outline on the IFSP plan, which tells you what goals that you're working on. And the sessions are about an hour long, so we spend 45 minutes or so working with the children and the parent that is there during the session. And then after that, documentation. So the parent will be signing off that you were there working with the child for that day and, what goals that you were accomplishing. So that's typically a visit in an early intervention setting. You're using what's in the home, working on those goals, and then after that, you might be driving to your next client's appointment. So the nice thing with early intervention, right, is you're directly in the home and you're working with families on the things that are meaningful and challenging to them. And that tends to work, really well. The schedule is flexible because you're setting your own schedule with the families. And if you need to reschedule, that's, certainly possible too. Some of the challenges with working in the early intervention setting is scheduling your clients back to back in a block or in a way that sort of works well for you. And sometimes you have no-shows, which basically means you show up at the house and no one is there, no one answers the door. So, or they do answer the door and they say, oh, Johnny just came home with a fever and I didn't think to call you. So now you've gone all that way, you've driven to their house and you're not going to have a session, which means you're not going to get paid. So those are sort of the downsides of the early intervention setting, but it's certainly nice to work with the young children and their families. If that's an area of interest for you, it's a really great opportunity to work with kids that are so young. Typically, as an occupational therapist, the earliest I've seen is 9 months old, and most of the caseload that I've had for early intervention is the 2 to 3 year old range, where they already have some identified challenges with sensory integration, or they are having difficulty with their daily life skills, such as getting dressed or eating, and that's where I'm being called in to intervene. So for early intervention, that's been my experiences, and I've really enjoyed it. In an outpatient pediatric clinic, typically my setting has been more geared towards sensory integration, and that's a special interest area of mine. So I really like the opportunity to work with kids and families looking at their sensory processing, looking at the environment. And the nice thing with that is both the sensory environment in the clinic, but then also outside and incorporating some nature into that and helping families figure out how they can do that at home, whether that's in their backyard or a park. Most of the children in the sensory integration or outpatient clinic tend to be between 4 years and 7 years old for my caseload, and a lot of those children have an autism spectrum diagnosis. So for the outpatient clinic, generally I show up about 45 minutes to an hour before my first scheduled client, check my schedule, set up the clinic for the day, and then I'm going to see clients back to back. Generally, sessions are about an hour long, again, for those clients. So that's a good amount of time to get the work that we want to get done, and then a short time to talk with the family, tell them what went really well in the session that day and maybe what we're working on for next week. And then typically the next client is coming in. The nice thing with that is that my clients are all blocked together. So if I'm coming in at noon and my first client is at 1 o'clock and I'm blocked through till 5 o'clock, I know that I'm going to see clients during that time period. If someone calls out, I can do my documentation at that time and still get paid for that period of time. So it's a very busy sort of setting, and it goes pretty quickly, which is, it's a good way to pass the time. And I still get that interaction with the children and their families, but it's a little bit more steady than some of the early intervention. The downsides is I'm not in charge of my own schedule. So someone else is scheduling the clients for me, and it is a block of time and everyone is counting on me to be there. So rescheduling is not really an option. So if I'm sick or need childcare for my own child, that is just a day that I have to cancel. And so everybody misses therapy that day. So that's definitely sort of a downside to that. The last setting that I'd like to talk about would be an outpatient clinic setting where I'm incorporating hippotherapy into my patient's plan of care. And certainly that's a specialty area for me as well, and something that I've really enjoyed. And in those cases, there are some similarities with the outpatient setting in that the clients are scheduled back to back. Our sessions are typically about 45 minutes long, incorporating the horse and the clinic into that time period. And I've had a variety of opportunities to incorporate different types of functional activities. So, in some cases having a clinic on site has been really wonderful, but in other cases not having that opportunity to have a clinic on site and being able to incorporate different areas on the farm for functional activities or different activities that I've brought along and set up in a stall in the barn. So there's lots of different ways to incorporate those, and generally that can vary between being scheduled like a clinic, please arrive at this time, you'll see your clients between, generally for that type of outpatient setting, I see clients a little bit later, so that tends to be from 3 o'clock to about 7 o'clock in the evening, so the hours are a little bit later. I'm getting home pretty late from that type of work. But in that case, again, the clients are scheduled in a block. In the case where if it's more private practice and I'm scheduling my own clients, again, I have a little bit more flexibility in scheduling them, but I still have a team that I'm depending on. So that would be my horse handler and another sidewalker, unless I have trained family members. So in that case, the whole team is depending on me to be there. So if I, set my schedule, my horse handler is depending on me to be there at that same time. So the nice thing about including hippotherapy into the client's plan of care for occupational therapy is it incorporates the nature aspect, which is really big for me. And the movement of the horse is a very powerful tool, so I can accomplish a lot in that shorter period of time. In those cases, the clients make really good progress, and I can see them typically for a shorter period of time, both in duration, so a 45-minute session, but also in length of time or frequency. So I typically see those clients once a week, and I'll see them for 3 or 4 months, and then we might consider a break in a plan of care, and then they would come back if they still have challenges at a later date. So it allows me to rotate through clients, so we have a little bit more opportunity to serve more clients, and also gives them a chance to incorporate what they have accomplished with the movement of the horse. So as an occupational therapist who specializes typically in pediatrics, I've really found it a rewarding career. I've liked that I have the flexibility to work in different settings and to incorporate a lot of the tools that are really meaningful to me. And I like the option to work with parents and the children to focus on the family. I think that's really important, and I love seeing the gains that the children are making. So as a pediatric occupational therapist, certainly a job that I love, and who doesn't love getting to play on swings and balls and go outside with the horses. So certainly a wonderful career, and I hope that you've learned a lot. Thank you.